do you scan the uterus? This is basically how it's done. First, you place the probe superior to the pelvic bone. Remember, the pelvic bone is your anatomic landmark. Once you do that, identify the bladder. So the bladder is your sonographic landmark. Again, remember, if you can't see the bladder, it will be very hard for you to actually identify the uterus, let alone the ovaries, okay? Make sure you can see the bladder. Most of the time, people don't see it because they're scanning too high. They're scanning too high up where you're scanning the bowel. So slide your probe down until you see the bladder and then start sweeping in transverse plane. Remember, when you are in transverse, the probe marker is always towards you. When you are sweeping, mental check all the uterine outline and see if there is any mass. So as you are sweeping up and down, identify everything, the uterus, the ovaries, and see if there is any masses. And then once you do that, you turn the probe 90 degrees towards the probe marker towards the patient's head and start sweeping in longitudinal plane. So again, you can only identify the endometrium in longitudinal. Let's take a look. Yeah, this is female pelvis in transverse scan. So I didn't pull it down so much, but you can actually you can actually put the probe down lower until it hits. See how it's angled downwards. Okay, because it's really down, it's really lower. So look at this angulation. If you are actually angling upwards, you will not be able to see the bladder. Look at this angulation. This is what you need to do to be able to see the bladder and the uterus. Okay. It really needs to be angled downwards. And look at the amount of compression that's done here. You need to actually really press on the pelvis to disperse all the bowel gas. Okay, and this is how we scan in longitudinal plane. From transverse, turn your probe 90 degrees. Again, angle downwards and sweep. Look at the angulation, it is always downwards. Okay, you can actually just pull the pants lower down. Okay, it has to be it is very low actually. You should stop your probe right at the pubic bone. So that's a transverse and longitudinal scan of uterus. So let's look at how it will be seen in ultrasound. So this is, look at this image on the left, yeah? So this is how we are cutting the uterine fundus, and you will be able to see endometrium in the middle. But this is not the view to actually measure endometrium, yeah? Let me just play this for you. Transverse scan, sweep, bladder, start seeing the uterus. And as we go, you can actually see the ovaries. Can you pick up the ovaries? Until finish. Yep. Okay, and then I go more again. I can actually see my ovaries. This is the left ovary. Remember, this is left and this is right ovary. The right ovary. So what is it that is obscuring the ovaries? You can see gas obscuring the ovaries. Okay, so these are all gas. Again, sweep. Look at this is rectum. See the uterine fundus. Sorry, uterine fundus, left ovary just now, and right ovary covered with gas. Okay, so this is what you should see when you are sweeping in transverse. Of course, if the bladder is not full, you will not be able to see all that. Okay, this is a demonstration of what image that we're actually seeing. So when we sweep, we're actually cutting from the fundus to the body, to the cervix, and towards the vagina. So the best are cut to actually document, because you're not going to document everything. So the best documentation should be where it is at the fundus, which is at this line, where you can also see ovaries, if can. Yeah, not all patients you can see, but so you can see the fundus, and remember, right ovary, left ovary. And please understand, if you have your probe the other way around, then this ovary will not be the correct side ovaries. Yeah.